The National Healthcare Group's flagship hospital is under lockdown. Tan Tock Seng Hospital has been at the front line since COVID-19 hit Singapore's shores. Now, it is at the centre of an outbreak with 13 linked cases of COVID-19 and more expected to be confirmed.
We are monitoring this particular cluster at Tan Tock Seng Hospital very closely. The next few days will be critical. If we find many more cases that suggest widespread transmission, we will have to introduce more measures to break the chain of transmission.
As of April 30th, the 13 COVID-19 cases comprised 8 patients, 2 doctors, a nurse, a cleaner, and a healthcare assistant. Here's a timeline of how the cluster unfolded. One patient had developed symptoms as early as April 16th but only sought medical treatment 2 days later. He was subsequently put into Ward 7D after testing negative for COVID-19. On April 20th, he was transferred to Ward 9D. Another patient in Ward 9D developed symptoms on Sunday. A nurse deployed to the ward developed a cough, sore throat, and body aches on Tuesday and tested positive for COVID-19 on the same day. After her infection was confirmed, TTSH locked down the affected ward and tested patients and staff members who had been there. 2 more staff members and 6 patients in Ward 9D tested positive for COVID-19. The cluster was announced on April 29th. 4 more cases are linked to the cluster at TTSH, bringing the total to 13 cases. Now, the hospital is under strict lockdown.
We are not allowing visitors into our wards till further notice. For those patients who are critically ill, we will allow visitors by exception on a compassionate basis.
New precautions have been implemented at TTSH. Along with the limits on visitors, non-life-threatening A&E cases will be redirected to other hospitals. Temperature taking and hygiene measures have been stepped up, and for those working in the hospital, all 1,100 inpatients and 4,500 staff will be swabbed. 76 staff who are close contacts have been placed on leave of absence awaiting quarantine orders, with hundreds more expected to do so in the coming days. And as the saying goes, prevention is better than cure. Authorities are taking no chances to ensure that the outbreak does not spread to other hospitals.
We remain vigilant to look to see whether or not there's any possibility that there will be other cases that go to any of our other hospitals. All our hospitals have been instructed to check on their processes to make sure that they are vigilant, disciplined, and strict with infection control within their hospitals, and that we are monitoring the situation very closely. We have not engaged all the measures that we could have done, but we've decided that we will impose or implement more stricter measures in Tan Tock Seng simply because this is where the current outbreak is. And we will monitor this on a day-to-day basis.
While the emergence of both this cluster and one linked to an immigration officer raises the number of community cases, authorities are confident that Singapore can overcome this bump in the road on its long journey back to normalcy.
This is the first time in quite some time that we have seen relatively larger clusters emerging in the community. So obviously it is cause for concern. But we have also learned from experience that in order to control and break the transmission chains, we must move in quickly to try and stop the transmission from spreading further. We now have better tools to do this. We have testing capabilities, we have a better tracing system using Trace Together and Safe Entry. So we are essentially using everything at our disposal to try and slow the infection, keep it under control, and break the transmission chains.